Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And our guest today is Tiffany Waltos. She's Director of Revenue and Analytics at Community Healthcare. Welcome, Tiffany.
Thank you.
It's good to have you here. We're here at the ECW National Conference. Lots going on. The money man hopped on stage to talk about revenue cycle.
He did. He made sure he closed out with that. That was perfect.
Yeah, I mean, which is really important these days, right? Getting
Yes.
paid. So we have a lot to talk about in that regard. But before we go there, tell us about yourself and community healthcare.
I have been with Community Healthcare in Ohio for 9 years. We have 19 offices, 17 are primary care, and then we have an OBGYN office as well as a physical therapy office with over 65 providers, including behavioral health providers.
That's awesome. So, you've been living this world of revenue cycle for a while. What do you think are some of the big changes in revenue cycle management that are happening lately?
Quality care and risk-based. So where the revenue was always on the front end, it's become a lot more on the back end, and reporting codes have become a lot more prominent in getting that information over to the payer to support the clinical work that you're doing.
Interesting. Has that made it a lot more complex for you and your organization?
It has. Instead of being so heavy on our schedules and billing everything out, it's more about capturing what we're doing for the patients and providing that patient care and really getting information over to the payer to support the level of care we're doing to get the revenue on the back end.
Interesting. Yeah, I mean, the detail that's needed to get paid these days seems like it's been a huge evolution.
Yeah.
Talk to me about how would you describe the importance of revenue cycle management, RCM at your organization? It feels like every organization is under financial pressures. What's been your experience and the importance of the work you do?
Gosh, I think it's the pivotal starting point of everything that we're able to do. Without the revenue coming in, we're not able to provide the level of care that we can. So there's a huge focus on making sure that we do that and do it effectively the first time so that we have that stream coming in to be able to provide for our patients. So we do work with an extra billing company that does the bulk work for us, and our internal team handles all the little denials and nuances with the payer in that level so that we can make sure we are able to improve what we're doing on the front end.
Interesting. You said something interesting, which was we want to do it the first time. It feels like that's a bit of a trend too, right? Like, how do we make sure that the claim is approved in the first process rather than getting the denial and have to refile? Is that kind of your focus as well?
Yeah, so we have a huge focus on trying to get clinical rule engines to help us out with that within ECW, and then a lot of our claim edits and things to that nature. Rule engines are huge for us. We want to make sure that we are able to see those claims in real time and get them to the payer in the fashion that they want to see them, which is not always the same across all payers. So huge focus on that.
That's awesome. So Community Healthcare has been working with eClinicalWorks RCM consulting services.
Yeah.
Why did you decide to work with them?
So we've been on ECW since 2009, and there's been a lot of evolution in that.
Yeah.
And you can read every manual that you can, and you can get pretty far in knowing what's available to you. But how it applies to your practice is what's most important. And the RCM services has really been able to come in and look at our setup and things like that to be able to tell us what we're missing or if there's a step that we needed to include. So they've been incredibly helpful in helping us automate as well.
Interesting. So it's kind of understanding the nuances of the system and how to massage it to ensure the best outcomes. Is that kind of how you describe it?
On a very personal experience, though. So they're in your EMR. They're looking at the setups that you have and not just overall generally how the system should work. So, and having that one-on-one experience with weekly meetings or whatever cadence that we seem appropriate for our interest in what we're looking to do has really helped us in not feeling pressured to come up with everything every week, but also going back and looking at changes that we've made and seeing if they're making an impact.
Interesting. Yeah, I think I've heard them say that if you've seen one doctor document, you've seen one doctor document, because they all do subtle nuances. They need to understand how your doctors are using the system and documenting to do it right. Tell me more about that experience working with them. Do you work with them occasionally? Are you working them on specific projects? And what have been, some of the impact of that?
We've been fortunate to be able to do both. So we sent over a list of things that we really thought that we wanted further clarification on, or looking for better outcomes or or is there something that we can do to improve this, whether it's bringing in revenue on the front end, setting up our eligibility checker differently, process and workflow from the front end to the billing department. But also they've been able to look in our system and run reporting and tell us where we need to make improvements. So it's been very collaborative of an effort to make us the best that we can be and really improve the system to work for us and us not to work for it.
That's awesome. It's great that you got to do both.
Yeah.
I think we'd be remiss if we don't talk a little AI. It's happening so much, especially in the RCM space.
Yes.
How are you seeing AI and agentic AI? How do you think it will impact RCM? How do you think it's going to be leveraged?
So we've been fortunate to see a lot of the features. We're on 12.02 right now. We're looking to go to 12.03. And the RCM consultant service has actually shown us a lot of the features that are available to us.
That's interesting.
Even from the claims screen, you're not always able to pull the data that you want, but with the AI and the overlay of that to say, I want claims denied for this reason, it's going to pull you that whole list. So there's a lot that can be unlocked through the AI features that we don't have right at our fingertips that would need to be pulled from reporting outside of the EMR through EBO. So there's a lot that's going to help us stay within the system and have it workable so that we're not working off a report and going back to the system. So it'll be great in that regard. It'll all be in one place. It'll also create rule engines for you based on your denials, which is going to be amazing so that we have those set up. And again, the front end is right where you want the money to come in and not have to work it on the back end.
Yeah, it's great that it's pushing it that way. I think the other thing is that there are a lot of redundant processes in revenue cycle, which makes sense why AI is so effective for it. So that makes a lot of sense. What do you see as coming next for your organization and for RCM in general?
So with what we've been able to learn, AI is huge for us. We want to move in that direction, obviously. And it's not so that we can reduce the amount of people we need, but we can reduce the capacity at which they can work and be able to do more for our providers, set up more rule engines, be able to help more in their visits, make sure we're capturing all our codes on the front, support all the coding as well. There was a lot of coding that would really be able to help our providers and reduce the amount of necessary audits and things to that nature and reviews at the encounter level, because there's also that part of the process too. So if the system can help them code, it's going to help them bill and it's going to help us collect.
Interesting. How do you think that things like Suno AI and the ambient stuff is going to impact RCM? Because it feels like it's going to capture a lot of data and could do, again, some of that front-end work coding-wise to ensure that it was documented the right way. How do you think this ambient documentation technology is going to impact RCM?
I think it's going to be fantastic. Another part of coding and billing world is reporting your assessment codes, your diagnosis codes. And a lot of that comes down to the HCC and reporting the risk to the payer. And we don't always capture that the best that we can, or it's an unspecified code.
Sure.
And in order for your relationship with the payer to work and them have the funds to be able to provide these contracts to you, you've got to paint the patient profile at the payer level. So being able to capture the assessment codes and get those all over to the payer will be fantastic, as well as coding the level of service to the level it should be and not the level they think it might be.
Exactly. I mean, it's interesting to think even 20 years ago when EHRs were first implemented, or probably called DMRs at the time, we wanted to do it not to upcode, but to code to what was actually done, but just wasn't documented. Kind of feels like a similar idea, right? And
that's another area of opportunity, right? With 17 primary care offices and 60 plus providers in that space, you're looking at coding inconsistencies. And so leaving that up to the discretion of the provider is not always the best, especially when you're talking about patient responsibility and they think it's more expensive to see one provider than the other provider. So if you can get that really consistent through the corporation, it'll help, especially, with the providers in the same practices that might have some coding discrepancies.
I've never thought about that from the patient perspective. That is fascinating.
Yeah.
Wow. Thanks for sharing.
In the billing department, you get to find out about that on the back end. That's
you hear about it from the patient.
Yes, you do.
That's absolutely true. Well, Tiffany, I appreciate you coming and talking with us. I know you're busy here at the national conference with all the learnings and connection that you have. So I appreciate you taking time to sit with us and talk with us. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks, Tiffany.
Thanks. I appreciate the opportunity.